Hello, this is Dr. Gay from First Look MRI, and this is a 13-year-old female who plays soccer. She's having pain in her foot, and they're worried about a metatarsal stress fracture. So in this view, we see that she has a second metatarsal that's a little bit longer than the first metatarsal, very common normal anatomic variant. And we also note that she has abnormal signal in her second metatarsal head here. So it's not the shaft like we normally think of for a metatarsal stress fracture. This is localized to the head. We can see this a little bit better on another view here, the T1 weighted image, where it really stands out here. So prominent abnormal signal throughout the epiphysis. And again, the second metatarsal is longer than the first. And there's sparing of the metatarsal shaft that we normally think of with a stress fracture. So when we see this, we think of Freiberg Infraction. Again, Freiberg Infraction or Freiberg disease. And this entity is usually in females, adolescents between 10 and 18 years old. And this fits perfectly. She's a female. She's 13 years old. It's often associated with a second metatarsal that's longer than the first. And they don't know why it's there, but they presume, since this is longer than this, often it's related to abnormal stress, microtrauma, or chronic stress on the metatarsal head. Sometimes people who wear high heel shoes get it, so they may have abnormal stress. A soccer player like this may have abnormal stress, and the second metatarsal being longer puts abnormal stress on it routinely. Now in this sagittal view here, we can see the metatarsal head has lots of edema. Again, we call this an osteochondrosis, just injury of the bone and cartilage there. And she did have one other thing. So this is the plantar plate over here coming up to the base of the second toe. This is along the lateral side. It looks nice and dark and intact. If we go the other direction to the medial side, we see there's a little defect here. So this is a partial tear of the plantar plate along the medial margin of the plantar plate. And the plantar plate tears also can lead to abnormal mechanics of stress and increased pressure on the second metatarsal head, and can also lead to this osteochondrosis, again, which we call Freiberg Infraction. Now this subchondral osteonecrosis, if left untreated or the stress remains, it can collapse the articular surface and be a mess. So we need to recognize that and have them treated appropriately so it can go on to heal. And again, Freiberg disease or Freiberg infraction of the second metatarsal head. Females 10 to 18 years old, and usually the second metatarsal is a little bit longer than the first. Thank you very much.